And it fits very well with the systematic review that we've used to plan today's webinar. And it really is all about it's a very easy to read report. It was a survey that was undertaken in the United Kingdom, and the report was issued in May this year. There were 4,500 adults who were surveyed, telephone interviews, and half of whom were in employment. So we know that that's a quite small sample from when we talked about sample sizes in our last webinar. However, I think it has produced some useful statistics and some even more useful recommendations. If we go on and have a look at what burnout is, this mind cloud just shows you some of the words associated with burnout and what the signs and symptoms of burnout might be. And we know that it is highly prevalent in the health and social care workforce at the moment, and probably has been on the rise. We know that in the burnout report 2025, the results were that 91% of the respondents reported that they had been experiencing a high or extremely high level of stress in the past year. But what they've also done is they have focused on the kind of workers who are more likely to experience stress. And I thought this would resonate with the social worker community, because I know from speaking to social workers, and certainly from my own experience as being a nurse working in clinical practice, we all had heavy workloads and we did a lot of unpaid tasks. And I know that the work that you guys do is predominantly field-based. And the findings from this report were that many field-based workers reported experiencing stress. And what they have done is they've come up with some recommendations as the report draws to a conclusion. And I wonder, just as we just kick off with this session, if I could ask you within 5 seconds to make a decision, if you had to make a choice as to which one of these 3 recommendations you would prioritise, which one would it be? If you were to decide today going forward that you were going to make clear and defined boundaries to protect your time and energy levels, if it was around making necessary adjustments to your work in order to facilitate a better work-life balance, and we're talking about here about actually doing it, not just thinking about it, or if it could be around seeking medical or psychological support as soon as stress builds rather than waiting until it becomes chronic and symptomatic. If you had to choose one of those, would you put number 1, 2, or 3 in the chat, please? And Ella will give us a review of which one, which kind of what the group is kind of thinking and which one's more prominent.
We've had one of each option so far.
Okay.
Another vote for number 2.
Okay. You see, it's very difficult. I know, again, from my own experience, and even just working in academia, sometimes lunch is something that you have on the move. Sometimes a work-life balance is very difficult to get right. You end up working outside of your normal hours. Sometimes people see seeking support as almost like giving in. And that you are more resilient if you're able to carry on. And that's not always the case. And one of the things that the report does focus on is the difference between burnout and stress. And whilst it says that, stress can be a symptom and a cause of burnout, they are 2 quite different things. Okay, Ella, any more updates on our group and
yes, 2's been the most popular option.
Okay, so I think everyone would like a better work-life balance, but it should be that we should see across the group, I think, engagement with all of these recommendations. So just bear them in mind as we go forward. So I think we're ready to kind of get on with the main part of the presentation today. And what we're looking at today, as we said, is about systematic reviews. But just a very, very quick recap on our last two workshops, where we looked at the construction of research studies. Understanding the stages that a good research paper goes through will help us to make sure that all the correct steps and the rules are followed. And we talked about the rules for qualitative papers in workshop 1. And the focus of this type of research was all about collecting qualitative data. And that was to gather insights into people's views and perceptions and values and beliefs. And we talked about it coming from the school of interpretivism, where the researcher believes that the world is not black and white, that human beings have diverse beliefs and they respond differently in various situations. And the answer is not always yes or no. Whereas in workshop 2, we moved on to looking at quantitative papers. And the purpose of quantitative data is to gather factual data, and generally it's to generate statistics. And the philosophy behind this was positivism, where these types of researchers believe that the world is black and white, and that a research question is answered with a definite yes or no response. Often it generates statistics. Now, both approaches, qualitative and quantitative, have their values. And which approach you take if you're conducting or constructing a piece of research will depend on the research question, and then you choose the best method to provide the most accurate response. So that's just a very quick recap. And as I said, Ella's put a link in the chat to the last two webinars if you want to take a look at them. So we move on now to what's a systematic review. And this really is going to be a whistle-stop tour of what a systematic review is, because it is in itself a distinct research methodology. And we're just going to give you an overview of the rules and the principles around systematic reviews, so that you will be able to recognise how the review was put together and has it been put together correctly. And in a nutshell, what's a systematic review? Well, it's something that's basically going to do all the legwork for you. If you want to find out the summative answer to a research question, it's really worthwhile looking for a systematic review, because if you find one, it means that someone else has gone out and gathered together all the studies which answer your question, and you will see what they found when they put all these studies together. Now, we need to think about how you would recognise a good systematic review, because like a qualitative research paper or a quantitative research paper, a good systematic review is going to follow a distinct set of stages. And this is basically what a good systematic review will do. It will follow all of these stages. So it will start out with identifying the question. The next thing it will do is set inclusion and exclusion criteria. So it will look at which studies are to be included and which studies should be excluded. And it looks at things like, the population. It looks at things like the geographical location. It might look at studies published after a particular date. And once you have determined all your inclusion and exclusion criteria, that then becomes your search strategy. And once your search strategy is in place, you run the search. And once you run the search, that's when it starts to get fun, because you get to see what studies are actually going to be suitable for inclusion in your systematic review. And it's at that stage where the researcher will select their studies. Now, we'll talk about that process in the next couple of slides, because that's probably the most difficult part of the, or one of the most complex parts of the systematic review. Once you have selected your studies, you then have to take the data out, extract the data, but you also have to assess the quality of the data. So again, like we did in workshop 1 and workshop 2, you will have systematic review. You have studies in your systematic review which have qualitative data, and you'll have to look at them and you'll have to determine how good or otherwise are they. If they're not of a certain quality, you probably need to reject them. And after you have assessed the quality, you'll then put them all together and you will synthesize them. So by synthesize, you're going to look at all of the results and you're going to see what these papers have in common, and you're going to present the results. And that's basically the various stages in the systematic review. Let's just move on to the next slide. So I thought at this stage it might be useful to just go back and talk a little bit about the search terms and some things that you will see in a systematic review, and quite often these can be quite confusing. People think, what does this mean? Well, let me just try and demystify it a little bit for you. So what sometimes the researchers need to do is they need to throw their net very widely, or they actually need to really hone in their search and make it very specific. So what you will see, one of the things that you will see, which you can see here on the second line, is the use of an asterisk after a word or a phrase. And if you have that asterisk, you will find that the search will pick up everything with words that start with the word which has the asterisk. So for instance, social work here will pick up everything that begins with the word work. So it will pick up workers, worker, working, worked, any word that starts with work. So straight away you can see that it might generate a lot of irrelevant studies. Now that is known as truncation, where you just present part of the word with an asterisk and then it'll pick up everything else. Whilst it might generate a lot of irrelevant studies, you have to be sure that you don't miss anything. Now the other thing that you can see in here is something which is called Boolean logic, and you see the or and the and, which is in capital letters. When you put those into a search, you can use them to narrow your search or to broaden your search. So or can broaden your search and not can narrow your search. And they can be very useful as well in terms of making sure that you haven't excluded anything. The other thing that you can see here are phrases which are in inverted commas. And if you have a phrase and you put it in inverted commas, the search will search for the entire phrase. So a search which used social work without the inverted commas in this instance here would bring everything that used the word social and everything that used the word work, which most likely would produce hundreds of thousands of hits, mostly irrelevant. Whereas if you have social work in the inverted commas, your search will only produce studies which has the two words together and in that sequence. Now, moving on, once you have done your search strategy and you've run your search, the next thing you have to do is you have to present what it was that you found. So I've used the Prisma diagram from the study that we distributed yesterday, and we'll put a link in the chat to that study in just a moment. But when we extract our studies, we generally use Prisma as a reporting mechanism. So this shows you the first instance, when the researchers did this search, they got nearly 3,000 hits. And then they had to remove duplicates, and there's software to do that. You don't have to physically go through every one of the 3,000 studies. We can use something called RefWorks, which you put in all your studies and then you see if any of them have appeared in other databases. So here they were able to remove 461, but that didn't really make their life terribly easy because they ended up with still nearly 2,500 studies. Then they had to screen them. Now, the first stage in a screening is generally to read the title and to read the abstract. And straight away, you can see whether or not this is going to fit with the research question that has been designed. And this was where they got the kind of, they really cut them down. So they managed to exclude all but 97 of the studies. So they ended up with 97. They ended up with 2 reports which were not retrieved. We don't know why. Now, the newer version of the PRISMA diagram, so this one is from 2015, the newer, because this study was published in 2024, PRISMA produced an updated version of their PRISMA record this year, and it actually asks for reasons why your reports weren't retrieved. My guess is that these weren't retrieved because they were published in something so obscure that the researchers couldn't find them. And then they had to go through the they had to decide whether or not they were eligible for inclusion. So that left them with 95 studies. Now, these 95 studies have to be read, not in great detail, but they have to be read to determine whether or not they're suitable for inclusion. And the reasons why these 86 studies were excluded are detailed here. So 53 of the studies didn't feature social workers, even though they would have had, you saw the search strategy that they used, even though they would have had the social work in the search. 53 studies were not about social workers. Another reason why studies were excluded, 17 were excluded because they didn't measure burnout as an outcome. And 16 studies had an incorrect study design. So they had decided in their inclusion and exclusion criteria what kind of study design they wanted. And this group of researchers had decided that they wanted quantitative studies. They didn't want qualitative studies. So 16 obviously had qualitative studies where people were interviewed, or something else was used in a qualitative way to get their views and opinions and thoughts and beliefs, whereas this particular systematic review wanted quantitative data. And finally, so they ended up with 9 studies which were going to be included in their systematic review. 9 is a manageable number. Excuse me. Sometimes I think when my students do systematic reviews, they're doing it for a dissertation, and I would say to them, try and keep it in single figures. Published systematic review could be in a lot more detail. You could have up to 20, maybe even more than 20. And the answer to the question is, how many should I include in my systematic review? The answer is however many there are. So it's not about choosing, which ones you want. It's about how many studies have actually been published that go some way towards answering your systematic review question. Of course, you can manipulate this a little bit by changing some of your inclusion and exclusion criteria, which I think is something that researchers sometimes do. Maybe they will shorten the length of time for publication, or they will change something around the types of studies that they want. So why do we bother doing a systematic review? Well, the whole point of the project that I'm working on at the moment to improve research capacity across Northwest London and the social worker community is to enable you to have a mechanism to ensure that your practice is based on evidence. And so by understanding what a systematic review is, by understanding what a good qualitative paper should look like and a quantitative paper should look like, you're going to be in a better position to be able to make that decision. Do I actually change my practice because of the findings of this study? Or, is it significant enough for me to make changes? Now, significant, again, it's a little bit difficult to give an exact definition of what that means. But broadly, I would say if 2 studies are coming up with the same findings, it might be a coincidence. If 3 studies are coming up with the same finding in my systematic review, I think there might be a bit of a trend. And if 4 studies are coming up with the same findings, answering the same question, then I'm thinking, this could be onto something here. Maybe we need to change the way we do things. And so the first thing you have to do is ask the question, Then you have to acquire the evidence, and that's what these sessions are all about. You have to appraise the evidence, and again, this is part of why we're showing you what a good piece of research looks like. Then the next stage is maybe perhaps the most complex stage. You have to try and apply it to your practice, and then the analyze. Can you actually determine whether or not the change you have made has resulted in an improvement? And the appraise part of the process, other than understanding what a good research paper looks like, we also have critical appraisal tools. So we have tools that actually help you to make a decision. And the fourth one of these webinars is all about how to do critical appraisal. And so we'll look at those the next time we meet. So the next thing we need to think about is the actual study, which I've sent out to you, and Ella's put a link to in the chat. And it's a systematic review. It's looking at it. It seems to tick all of the boxes. It starts out with an abstract. Moving on, it has a decent introduction and background to what burnout is and how burnout is affecting social workers. It goes on to talk about the methods, and it says that the study was conducted by using a systematic review and using the Prisma diagram to present the actual results of the search. Talks a little about its inclusion and exclusion criteria. It's much longer than papers I've sent you before, and that's because there's probably about 10 pages of data, which is each page is like a summary of each of the 9 studies that was included in the systematic review. So you can see at a glance what the studies that were included look like. You can see where they were undertaken, what the sample looked like. You can see a little bit about the intervention details and the intervention findings of each study. What the researchers then had to do was go on and look at whether it was quantitative data, so they had to do an analysis of the data. Now, they weren't able to do a meta-analysis, and a meta-analysis would be if you were to think about tea and coffee, and you wanted to find out what was the favorite, if you wanted to see what kind of tea was the most popular tea in England, you couldn't do a meta-analysis if people were drinking coffee rather than tea. You wouldn't have been able to include that data. And that's something called heterogeneity. That's where it's almost like you're dealing with apples and pears. You can't compare them, because apples you can compare with apples, and pears you can compare with pears, but apples and pears you can't combine them. So it wasn't possible to do a meta-analysis. They went on then to talk about what they found after they presented all of their studies, and they came up with some useful recommendations, and they also acknowledged some limitations and strengths and limitations of the study. So what we're going to do now is just ask you just to see how much of this you managed to pick up, and then we'll talk about some questions. So we need to think about always the red flags. What do you watch out for? What would be your signal to say that this systematic review didn't really add any value? It wasn't well conducted. So the first thing we always think about is the research question. This is a bit of a general question. Now, this is for you in your own role. Do you think the question is relevant to your profession? And I'm going to ask you to put it in the chat. It can be yes, no, maybe, whatever you think. But they have identified the questions at the end of the 3rd page, where they say what interventions have been implemented to prevent or reduce burnout in social workers, and how effective are they? And once you've had a chance.
Sorry, Catherine, I was just going to say, I've just launched that as a poll, and we've had 2 responses saying yes so far.
Okay, great. So Ella's keeping control of the responses as we go through. What does everyone else think?
Had a yes in the chat and then also a vote for no.
Okay. There is no right and wrong answer here. It's really about, because every time you read a research paper, it's not going to be relevant to everyone. We're very diverse audience, and the same things won't apply to everyone. Okay, we'll move to the next question. Ella, over to you.
Yeah, so the next question is, are the inclusion and exclusion criteria clearly listed? And your options are yes or no. And I'm just going to launch that as a poll again now. If you can't see the poll, feel free to just pop your response in the chat. So we've had a vote for yes so far.
How many people have we got in the webinar, Ella?
We've got 9 people, so 7 excluding you and I.
Okay, so we should be hopefully getting 7 answers to most of these.
So we've had a not sure vote.
Okay. Is that everyone done?
Another not sure and another yes.
Okay. In my opinion, I would probably have voted for yes. I think they've made it clear, they've used ECO, which is about the population, the intervention, the comparison and the outcome. Maybe they could have been a little bit more descriptive. They give us their eligibility criteria, maybe a visual of what their search strategy looked like at the very end might have been more helpful. So I think I can be a little bit on the fence with that one. This is the next one, Ella.
So next question is, which of the following methods were used to display the search findings? So I will launch that now. Your 2 options are a Prima diagram or an Excel spreadsheet. Again, if you can't see the poll function, feel free to just put your answer in the chat.
I have to apologize for the spelling error here, because that should say Prisma diagram, which hopefully that will resonate with you. You might have heard the word earlier today.
So 2 votes for Prisma diagram so far.
Okay. What does everyone else think? Some people maybe might have a copy of the paper and they might be searching through it.
Another vote for Prisma. 2 more votes for that.
Okay, I think that is great, because it is definitely a Prisma diagram, and that would be kind of industry standard to use something like that. Here's your next question, Ella.
So the next question is, how did the researcher decide which studies should be included in the systematic review? So I'm just launching that now. There are 3 options here. A, studies only published in the UK. B, by conducting a critical appraisal of the studies after the screening. And C, every study from the search was included.
Okay, we'll give people a moment to digest that one. The clue for this one is which studies should be included in the systematic review.
So we've had a couple responses for option B so far.
Okay.
Another vote for B.
Okay, anything else coming in?
Not yet, no.
Okay, well, the people who voted for B are absolutely right. It was by conducting a critical appraisal. That's really important, because there's no point in including studies that are that are not of the required standard. If it's a bad piece of research, there's no point in putting it into your systematic review. Here's the next
question
one.
Is how was the data analysed? So 2 options, A, thematic analysis, or B, statistical analysis. I'm just launching that now. And we've had narrative synthesis put in the chat, and then a vote for thematic analysis.
Okay. Anyone else got anything to throw into the ring?
Thematic analysis again.
Okay. Everyone else is unsure, perhaps. And I appreciate that we only sent the paper out yesterday, so you may not have had a chance to read it yet. But the clue is in the presentation when I talked about the fact that only quantitative data, studies which use quantitative data were included in the systematic review, and that was in the inclusion criteria. And because it was quantitative data, it was numbers. And so because it was numbers, the type of analysis they did was a statistical analysis. If they had been collecting views and opinions and thoughts and beliefs, and they had interviewed people, then it would have been a thematic analysis, but they didn't do that. They deliberately excluded it because they wanted to measure an intervention in this particular systematic review. So the answer to that one is B, the statistical analysis. Okay, I think we've got, do you think, Ella, you can go with this one?
This question is, do you think the researchers adequately addressed the limitations of the study? So this is just a yes or no answer, which I've just launched again.
Okay. And limitations are very important, and they're very important particularly for generating more business for yourself. So if you're a professional researcher, a good researcher will always say, and further research needs to be done on this particular topic. So do you think that the researchers in this particular study identified, what the limitations of the study were?
All votes for yes so far.
Yeah. I think they did. I think they gave us a good insight into what they thought was wrong with it, and they actually talked about it in the abstract, which I thought was quite good as well. And they talk about the overall quality of the studies were poor, and therefore recommendations for effective interventions could not be offered. Which is quite concerning that the primary research wasn't actually there, but they acknowledge that. It's also good to read that the quality of the studies were poor when they did the critical appraisal, because critical appraisal is not a subjective thing. It's not somebody's view, or it's not, oh well, I didn't like it. Critical appraisal is about a list of questions that you have to ask. And then you give it a score, and you can decide from the asking of those questions whether or not something is suitable for inclusion. Okay, so we want to know what are your takeaways after reading this study. But just before we go into the discussion, I just really want to sum up in as simple a term as I can what a systematic review is. My analogy for this would be, it's holiday time, lots of people are booking their holidays or getting ready to go on holidays, and I'm thinking that you all know what TripAdvisor is. So if you use TripAdvisor and you look on TripAdvisor and you find or you look for your hotel. Then you go to TripAdvisor to find whether or not it's a good hotel. And you can see that there are a mix of good reviews and bad reviews, but perhaps more good than bad. So you're trying to decide, do you read the bad ones or do you just go with the good ones? You need to take everything into consideration. Now, when you go to TripAdvisor, they produce something called a reviews summary using AI, which kind of begs the question, is the day looming when we won't need researchers to do systematic reviews, that AI is going to do it for us? But that's a whole different conversation. But what they do with the AI is it focuses on the common themes that emerge across all of the reviews. And they also mention some of the less common themes, which are only appearing in some reviews, perhaps the kind of the lesser the least complimentary of the comments that have been made. And a systematic review is very similar to that. It gathers together all of the evidence that focuses on one particular research question, and it will tell you, when they put all of these studies together, what do they actually find out.